Hello, and welcome back to the Optum Care Virtual Community Center. Today, Rich is going to talk to us about a very important topic, mental health awareness. Hope you enjoy.
Well, hello everybody. My name is Rich Crislip. I'm the director of our Behavioral Health Integration Program at Optum Care. And welcome to Healthy Minds. Today, we're talking about a very important subject on mental health awareness. You know, mental health awareness is one of those areas that sometimes can be a little uncomfortable to talk about. Sometimes people will feel like this is a very private topic, a very personal topic, but it is a very important topic because it has a huge impact on the quality of our life. Mental health awareness is important also because it impacts a lot of people. It's estimated that people 55 years or older, they estimate that 20% of people 55 years or older will experience at some point an episode of mental health issues, whether that be depression, anxiety, perhaps a chemical dependency issue like alcohol abuse or drug abuse. It's very common, and it's something that, again, is common, but we often are uncomfortable talking about it, whether it be about ourselves or to talk about it with a loved one, a colleague, friends, and family members. So today I just want to talk a little bit about how do we do that? How do we look at what's going on with ourselves, but also with the others around us when it comes to a person's mental and emotional health? So first thing is that what do we look for? What are things that tend to indicate that there might be mental health concerns arising either within ourselves or with someone around us? And one thing you really want to look for is that, well, how long is this lasting? Is my sadness and my moodiness, my irritability, or with somebody in my family or someone around me, is this going on for a few weeks, a few months? Because everybody has days where they're irritable and moody and sad. Everybody has times in their life that they do have a low mood, that they do feel emotional despair. But when it comes to a mental health concern, it really is about how long has it been there? Is this lasting for a consistent amount of time? Are we looking at where we're on month 3 that this is going on a consistent basis and it's very noticeable? Do we notice in ourselves just a lack of motivation to want to do anything? We don't feel like doing anything. We don't have the joy that we once had and the activities that we liked. We just are feeling flat. It's hard for us to bring on positive feelings. Or we have a lot of fatigue. Our energy level is down. We feel like escaping and isolating and sleeping a lot. Or we're not sleeping at all. We're up a lot, worrying and feeling anxious. And all these things really impact our mood. Or perhaps it's getting to the point where you're starting to feel like, I want to give up. I don't want to be around other people. I don't want to live anymore. I don't want to be in this world anymore. When you start thinking those thoughts, or you hear loved ones or friends or colleagues saying those kinds of things, these are alarm bells that are showing that, yes, there's more than emotional distress going on, that there may be a mental health issue going on that needs to be treated. So what are the tips for this? What do we want to do when we see it in ourselves or when we see it in other people? Because it's important. It's going to impact the quality of our life. It's going to impact our physical health. It's going to impact our social relationships. It's something that we need to confront and deal with. Is that number one, we always want to talk to our doctor about it. Whether that be your PCP, your provider, your physician, is that you go in and share with them what's going on. Is that, be open. I know sometimes that's uncomfortable. I know sometimes you feel it's private and I don't feel comfortable talking about it, but try to break it beyond that. Or if it's with a family or a friend or another loved one, is that put them in a comfortable situation to say, hey, you know what? I love you. I care about you. This is what I see. Let's talk about it. Reach out to physician, doctor, nurse, but also reach out to family and friends. And if we are that family and friend, that we reach out to them and we start opening the conversation in a sensitive way. And the third thing is that, there is help out there. Know that there is help. This is sometimes when you feel real low moods, like depression, or even chronic worry and anxiety, it can feel desperate. It can feel like, you know what, there's no hope. This is never gonna go away. I'm always gonna feel this way. But actually, that's not true. There are excellent services and supports and treatments out there for all different types of mental health issues. And it's something that, of course, you have to be open to and talk about with and look into it. But if this is going on, and this is going on in you or going on with a family member or friend, just remember that. Number one, let's talk to our provider. Number two, let's reach out to people that are my supports. Let's begin to open this up and have a conversation about it. And number three, know that there's help, and perhaps getting to see a counselor or going to see a doctor to talk about medications, to talk about different treatment options, that there's an array of services out there that we can help you with. So know this mental health awareness, either for yourself or with others. Please use this, and I hope that this is helpful in dealing with this sometimes hard issue that we all have to confront from time to time. Thank you for joining us, and we'll see you next time.